Welcome back, everyone. We're going to start our toxicology series with taking a look at toxicology as an overview. National EMS education standards for medical emergencies states that we should be able to integrate assessment findings with principles of epidemiology, pathophysiology to formulate a field impression and implement a comprehensive treatment plan or disposition plan for a patient with a medical complaint. For toxicology specifically, we need to be able to recognize the recognition and management of things like nerve agent poisoning, carbon monoxide poisoning, as well as how and when to contact poison control centers. Anatomy, physiology, pathophysiology, assessment, and management of inhaled poisons, ingested poisons, injected poisons, absorbed in poisons, alcohol intoxication and withdrawal syndrome, and opiate toxidrome. We also need to understand the anatomy, physiology, epidemiology, pathophysiology, psychosocial impact, presentations, prognosis, and management of the following toxidrome and poisons: cholinergics, anticholinergics, sympathomimetics, sedatives, hypnotics, and opiates, as well as alcohol intoxication and withdrawal, over-the-counter and prescription medications, carbon monoxide poisonings, illegal drugs, and herbal preparations. Toxicologic emergencies require you to think critically to identify the substances involved. You need to be able to determine your differential diagnosis and formulate your treatment plan based on the anticipated clinical course for your patient. This requires an integral understanding of the various toxidromes, and as which we'll have subsequent lectures that go through each of the common toxidromes needed and discuss specifically the patient presentation, the treatment fundamentals, and the progression of each of those. Toxicology as a term refers to the study of toxic or poisonous substances. Pharmacokinetics, as a reminder, is the activity of a drug in the body over time, and a drug is a substance that may have some therapeutic effect when given in the appropriate circumstances and appropriate dose. A poison is a substance that can damage structures or impair function in the body, while a toxin is a type of poison or harmful substance produced by bacteria, animals, and plants. The term overdose refers to the outcome of taking a drug in excess. Bioavailability is the percentage of an unchanged substance in systemic circulation, while half-life indicates the average person's ability to eliminate 50% of the plasma concentration over a period of time. Excretion is the removal of a drug from the body, and an antidote is something that counteracts the effect of a poison. As far as types of toxicological emergencies, we've got intentional and unintentional. Intentional toxicologic emergencies can include things like criminal activities or suicide. Unintentional can occur in many ways and common in children who mistakenly take poison or put poison into their mouths. And this can also occur in the workplace. Poison centers can provide a rundown on a poison's ingestion, a poison's toxic potential, steps to negate the patient or negate the effects of the poison for the patient. And for EMS providers, serves as an invaluable resource. In fact, when you call the Poison Control Center, not only will they help be able to give you, the EMS provider, information on suspected presentation or anticipated treatments that you may need, they'll also notify the receiving facility and have them be prepared with what they may expect once the patient arrives on scene. So you should definitely have this number stored, memorized, and never hesitate to call or reach out to Poison Control. It's a tool in your toolbox and can be invaluable for patients who've ingested substances that you're just not sure what to do with. As far as routes of entry, you've got poisoning by ingestion. This is where this can cause immediate damage depending on the type of poison that was ingested, or it may have delayed effects. These can be both intentional or unintentional, and it may spend a varying amount of time in the stomach. Management for this type of route of poisoning really revolves around neutralizing the poison. Poison by inhalation is when a toxic agent is present in the environment and it's inhaled. Problematic for us as EMS providers. The EMS provider is also at risk if the patient hasn't been removed from the area. Again, it can be intentional or unintentional, and responders may require special precautions such as SCBA units when entering the scene to retrieve the patient. The window for identification and treatment is going to be limited for these types. You need to consider scene safety pretty inherently. And if you recognize that it's an environmental or inhaled toxin as you arrive on scene, you may need to consider vacating the premises until further equipment can arrive for you to get back in safely. Utilize your Poison Control Center and medical control and correct hypoxia if present for these patients. Poisoning by injection is when you've injected a poison, usually to gain access as the result of stings or bites from insects and animals, as well as voluntary or intended poisonings by the consumption of material that's injected. So, for example, recreational drug use. Possibilities vary by geographic location for as snake bites, scorpion stings, jellyfish stings, wasps, yellow jackets, hornets, and such. Some poisons are neurotoxic, others produce localized or systemic reactions. Physical findings and presentation on the patient can provide some clues there, and the patient may be able to identify the culprit for you. Abuse of IV drugs, as mentioned earlier, may also be a source of poisoning that indicates a response for EMS providers. Poisonings by absorption, this is things like pesticides are often the most common and most serious. Scene safety is going to be paramount, as well as decontamination and involvement of a hazmat team might be required. Toxidrome is a syndrome-like symptoms of a class or group of similar poisonous agents, and this is how we'll break down subsequent lectures for toxicology is by toxidrome. It's useful for remembering the assessment and management of different substances that all belong into the same group. So you can see a table of some of the toxidromes here in some of the brief sort of presentations. So you have narcotics, things like morphine, codeine, heroin, methadone, etc. Your presentation or your toxidrome for an opiate and opioid overdose is things like hypoventilation. While you have things like your cholinergic, which are organophosphates or sarin gas. You can use a dumbbells mnemonic for this: diarrhea, urination, meiosis, and so forth. And we'll expand upon these in subsequent lectures, but it's worth understanding that term and how we assess and treat these by toxidrome. Substance abuse often results in a social stigma. In addition to the physical effects, we're seeing a wide and growing variety of substances that are being used today. And definition of substance abuse differs among cultures, so there's some cultural competency that's going to need to be involved here. Drug abuse is use of drugs that can cause harm to the user or others affected by the user, and habituation is the psychological dependence on a drug or multiple drugs. Understand that drug abuse does carry oftentimes physical dependence, and this is a physiologic state of adaptation to a drug, and this is part of what makes addiction and drug abuse such a complicated psychosocial and sociographic sort of problem, is that as the patient continues to use medications or abuse medications over a period of time, the body begins to reduce its production of chemicals or overproduce certain chemicals based on that continuous stimulus of that medication, and thus it creates a physical dependency. There's also the psychological dependent side of it, and it's the emotional state or craving that a drug to maintain their well-being. And this makes breaching this cycle of addiction very, very difficult and a legitimate disease process among patients. Tolerance, you've got the physiologic adaptation to the drug effects, which we talked about. Withdrawal syndromes can occur, or withdrawal symptoms can occur after an abrupt cessation of a drug, and we would note this as a withdrawal syndrome. And then drug addiction is the chronic disorder characterized by the compulsive use of a substance. And understand that drug addiction is not just a choice. It's not always just an option that someone chooses to do. There are physiologic repercussions that have taken place over a period of time that rely on the presence or presence of that medication to function normally. So drug addiction is a legitimate disease process, although the state to getting there initially may have been a choice, but the maintenance use of a drug addicted user is not always within their immediate control. An antagonist, as a reminder for pharmacology, is a drug with an affinity for a cell receptor, while an agonist is a drug that stimulates directly. Overview of substances. So you've got potentiation, which is the enhancement of an effect of a drug by taking it with another one, and then synergism, which is the action of two substances in which the effects are greater than the independent effects. And this is the 1 + 1 = 3 example. So a little bit of this one and a little bit of that one lead to a more than cumulative response of that medication.